What is gout or gouty arthritis? In simple sense, gout is caused by hyperuric acidemia. That means if the uric acid level in the blood is more than a certain required level, then those uric acid crystals, they precipitate in the joints and cause pain. So if you are suffering from gouty arthritis, that means the uric acid level in the body is more and it is depositing in the form of crystals known as toffee crystals. So this causes pain, swelling, redness and inflammation in the joint. Normally the most commonly affected joint is the big toe of the foot. So there is a severe pain in the big toe of the foot, which is normally the first site for this gouty pain. So now gouty pain can affect other joints also, like other joints of the foot or ankle or knee. Pain can start immediately without any obvious history of trauma, and normally it starts in the night. So normally the person wakes up in the night with severe pain, swelling, redness and inability to walk in the middle of the night, and normally the first toe of the foot or the big toe is normally affected. Now what are the reasons for this hyperuric acidemia in the body? So this normally happens because of 4 reasons. First is if the body is not able to excrete out the excessive amount of uric acid, which can affect in the conditions affecting kidneys. So if the body is not able to throw out uric acid, then the level increases. Secondly, if your diet is rich in uric acid or protein. So if you are a strict non-vegetarian, that can lead to hyperuricemia, or if your diet contains too much of protein, then also it can cause elevation of uric acid, or if you drink too much of alcohol, especially beer, that can also lead to hyperuric acid levels in the body, or if your diet is rich in fructose, which is a form of fruit sugar. Except for this, few other conditions can also lead to high uric acid levels in the body, which are in the form of metabolic syndromes. So if there is a metabolic syndrome in which excessive uric acid is produced, that can also lead to gout. Fourth important reason for uric acid syndrome or gout is if you are taking medicines that produce excesses of uric acid, like TB medicines or anti-cancer medicines. So if you are having gout because of any of these 4 reasons, don't worry, visit your doctor. He will see you clinically. First of all, based on clinical examination only, he should be able to identify that you are suffering from gouty arthritis. So he will ask you to take rest, apply ice over it, take anti-inflammatory medicines, pain medicines, or he might also ask you to take short course of steroid and keep your leg elevated. If the pain still persists, he might ask for joint fluid aspiration, or he might give you medicines in the form of specific uric acid reducing medicines so that the uric acid level comes down. If you are having recurrent episodes of uric acid related gout, then you should follow these 5 instructions. First is you should drink a lot of water so that the uric acid gets washed out from the body. Second, you should not take high protein diet. Third, you should avoid alcohol. Fourth, you should take diet which is less in fructose of fruit sugar. And fifth, if in spite of all these things you are still getting gouty arthritis episodes, then you should visit your doctor, get your kidney checked, or you should get yourself checked for metabolic syndromes that produce too much of uric acid in the body. Because if these uric acid episodes or gouty episodes become recurrent, it can lead to frank joint damage also, which can very well be seen on CT scan. And if because of these repeated episodes the arthritis settles down in the joint, then it can lead to permanent pain or disability in the joint also. Thank you.